Back to the Drawing Board is designed to encourage aphakic individuals who are severely impaired in verbal expressions to communicate feelings, needs, and events through drawing. The ultimate goal of BDB is for the patient to use drawing for everyday communications when other means of exchange are unsuccessful.
My work as a speech pathologist in this clinic, which is Art for All Clinic, who fosters more on people with aphasia, who have difficulty with communication, neglect, and more. One of the most common program we use in our clinic is Back to the Drawing Board program, which helps our client communicate events, feelings through drawing.
Patients who are considered for the BDV program should meet all of the following criteria. The patient should have a Boston Diagnostic Aphasia Examination severity rating of 1.0 or 1.5. The patient should be able to place 3 triple panel and caption cartoons in the proper sequence. The patient should be able to point out the humorous segment in 6 single panel uncaptioned cartoons. The man draw for the Boston Assessment of Severe Aphasia should be immediately recognizable as a man.
After determining that a patient is a good candidate for a drawing program, I, as the clinician, would now explain the merits of the program to the client.
To assess the patient's potential capacity for functional use of drawing, a pre-treatment and post-treatment drawing measure called the Daily Mishap Test was developed. In this test, the patient observes scenes enacted by a person other than the treating clinician. Following each scene, the patient is presented with either 1, 2, or 3 5x5 cards for depicting the scene just enacted.
One-part scenes. A woman has difficulty opening her umbrella. A woman leaning on a desk knocks on a book on the floor. A woman pours water into a cup that has a hole in the bottom and the water leaks out. Two-part scenes. A woman is shuffling cards. She then loses control of them and they scatter all over the table. Three-part scenes. A woman walks into a dark room. She turns on the light, then she opens the drapes.
After the pretest of DMT, the clinician would now initiate the DMT program. The steps should be modified or augmented according to the individual patient's performance. Allowances should be made for use of non-preferred hand, but the drawings should convey the correct message. First, present the patient with a 1-panel card and captioned cartoon and let her study it before turning it over. Then, ask the patient to draw the cartoon from memory on a unlined 5x5 card. Then, evaluate the patient's rendition of the target cartoon. If the main theme is recognizable and the picture contains details critical to the scene's humor, then present a new single panel. If the main theme is not identifiable or if critical elements are missing or unclear, work with the client to improve his or her performance. Once the patient has drawn 5 single-panel uncaptioned cartoons from memory, introduce the first 2-panel cartoons. Repeat the steps until 4 recognizable 2-panel cartoons can be drawn from memory. At this point, introduce the first of the 3-panel cartoons with 3 blank cards for step 1. When 3 recognizable 3-panel cartoons have been drawn from memory, re-administer the daily mishap test. After the re-administration of the daily mishap test, the clinician should give the pre- and post-treatment sets of DMT drawings to a naive rater, requiring that he or she try to write a description of the main theme and the details conveyed by the patient's drawing. If the patient has improved in his or her ability to depict the DMT events through drawing, then a second, less formal phase of training will begin. The within-treatment goal of Back to the Drawing Board program is for the patient to produce acceptable rendition of the cartoon stimuli to memory.
A less structured program involving family members or caretakers is initiated. The goal of this phase of training is for the patient to successfully convey a unique message to the interactant. Untrained individuals who do not know how to extract information from the drawings of a phasic patient can be trained to use the questioning strategies, which include identifying general themes, elements, using interactive drawing, and encouraging multimodal expression. Even if the patient and family members communicate successfully within this format, the better test of effectiveness of the drawing programs is the extent to which daily communication improves. Through the anecdotal information and drawings provided by the patients or family members, one can try to judge the generalized effects of the training.